Thanks everyone for joining today. I have about 8 minutes to tell you about the challenges and some opportunities with contemporary guideline-directed medical therapy, and also give you a quick overview of the mechanism of action for baroreceptor stimulation. So heart failure is a chronic and progressive disease, and all we do in our clinical day-to-day practice is trying to make this curve less steep to improve quality of life of our patients and certainly extend the life of them as well. Majority of the time I spend is actually on the right side of this curve, and a lot what we talk in the advanced heart failure world nowadays is those windows of, I don't know if, is it going in and out? Is it good? Okay. Sorry. Majority of the time what we spend talking in advanced heart failure therapy world is those windows of opportunities to delay the end organ intervention given the critical problems with or the timeline that starts with that. And namely to, again, extend that curve and decrease the amount of the downturns that hospitalizations to hopefully target the quantity and quality as well. So in 2022, finally, AHA, ACC, and HFSA updated guidelines and solidified the role for quadruple therapy as a foundational therapies for heart failure with reduced ejection fraction. Undoubtedly, those therapies improve mortality and morbidity for patients with heart failure. Well, the unfortunate part of it is that field implementation of guideline-directed medical therapy is struggling for a multitude of reasons, for the inertia on the provider side, for the perceived barriers to implementation of therapies, and quite frankly, a large proportion of patients, even those who get through those barriers, remain on the undertreated doses or not up-titrated drugs, as well as some of them get off the drugs because of tolerance problems and so on. So unfortunately, quality of life data with guideline-directed medical therapy is not nearly as good as morbidity and mortality data. And here are the three major news-breaking trials. Here are looking at the quality of life, ADAPT-HF, EMPEROR-Reduced, and PARADIGM-HF. And I also have a slide looking at the exercise capacity, which kind of looks even worse than that, and nowhere near to device therapy such as CRT, which you can see on this slide, where the exercise capacity certainly improves drastically using the devices. So in cardiovascular training, it is engraved in our brains all the time that mortality is the key to treating the patients. Well, interestingly enough, our patients don't think the same. Majority of the patient actually would prefer a shorter lifespan with fewer symptoms over a longer lifespan with worsening symptoms. And certainly this is one of the windows of opportunities that can be identified for the purpose of today's discussion. It's only 30%, roughly 30% of those patients with an YHA class 2 and 3, EF less than 35% on guideline-directed medical therapy would be candidates for CRT-like therapies, and 70% of them will not be candidates. They will be struggling with quality of life problems and persistent symptoms with worsening heart failure. So speaking of the mechanism of action of the baroreflex activation today, I'll bring up the slide from medical school and physiology books where autonomic nervous system gets explained real well by being a big part of the cardiovascular hemostasis. Particularly the arterial baroreceptor has been one of the afferent limbs of the peripheral nervous system, trying to balance the output of the efferent parasympathetic and sympathetic tones, which unfortunately, due to decreased baroreceptor signaling in patients with heart failure, gets imbalanced and leads to dysregulation of cardiovascular system. Namely, increased sympathetic tone, parasympathetic tone, and worsening heart failure symptoms, causing the progression of heart failure disease itself. So Could electrical stimulation or stimulation of a baroreceptor at the carotid sinus rebalance the autonomic nervous system and potentially change the paradigm of heart failure? And to answer this question, I brought up a few slides just to show you. This is older data sets from single center studies looking at the heart failure patients receiving the Baroreceptor therapy that shows that it does decrease the sympathetic tone, which is evident by muscle sympathetic nerve activation. And also from a different data set looking at the alike-looking cohort, Baroreceptor increases the parasympathetic tone, which is evident by increase in HRV high-frequency domain with the stimulation. So knowing this, the theory would be that by decreasing the sympathetic tone in patients with heart failure and increasing parasympathetic tone in those patients, we can change the paradigm of heart failure and improve the symptoms.